Okay, my name is Cassidy Sandoval, and I'm here with Kelly today, and we're going to be talking with you all a little bit about clinical psychology, different careers in psychology, some information about the graduate school application process, and then also speaking a little bit about our paths to get to a clinical psychology PhD program. Both of us are currently students in the Virginia Consortium program in clinical psychology, and kind of what grad school looks like for us and our clinical experiences thus far. So to get us started, we're going to talk about the graduate school application process and just the different degrees that you can have in the helping professions. So the first one is master's degree, so like Master of Arts, Master of Science, Master of Social Work, and these refer to therapists and counselors and social workers. Most of them work as clinicians or as patient advocates. The programs typically last 2 to 3 years. And then there's also doctoral programs, and they can either be PhD or PsyD programs. And this is where like when people go to become like a psychologist, they typically enter a doctoral program. Some states do offer licensures for psychologists at the master's level. For example, in North Carolina, you can become licensed as a licensed psychological associate at the master's level with a master's degree in clinical psych, and you're just supervised by a licensed psychologist throughout your career. Doctoral level psychologists, though, they are able to work in academic settings. They're able to do clinical work, including like therapy and assessment. And those programs typically take about 5 to 7 years to complete, depending on the path and the program curriculum.
Yeah, and so as Cassidy was presenting, there's a number of different master's level programs that you can go into as to get a more clinical degree in psychology. So first you can become a school counselor, and oftentimes that involves, of course, working in the schools, but mainly doing assessments. So you'll typically do like intellectual assessments, assessments for ADHD or specific learning disabilities, basically anything that a student would need an IEP or a 504 plan for to help improve their educational experiences. A clinical mental health counselor, that's actually, I'll explain a little later, but that's my master's level degree. So individuals who are clinical mental health counselors generally do therapy. They work with individuals across the lifespan. This says adolescents or children, but it's really any individual from children through geriatric populations, and you can work really in any sort of setting. So that could be private practice, it could be in hospital settings, anything like that. Marriage family therapists, similar to clinical mental health counselors, you're often working in the community, but your theoretical orientation that you're approaching clients and clients presenting problems from is based on family systems therapy, that sort of framework. So oftentimes you can work with individuals from with this sort of degree, but it often or also gives you the opportunity to work with, for example, an adolescent and their parents. You can do like couples work as well. And so it just gives a little more flexibility in that sense. And a master's of social work is broader as well. There are different tracks you can go into as a social worker. So you can do like clinical work, just like any sort of mental health counselor or professional counselor, but also social workers generally have more of like a welfare or like a systems perspective as well, in that you're often connecting individuals to resources. So you typically work with individuals who are low income and whose families need support in terms of just getting like basic living needs, things like that can support their mental health as well. And all of these degrees, they generally require about 2 years after you get your degree. So, you go through the programs, which are usually about 2 or 3 years. Then these programs also require that you spend an extra 2 years practicing out in the field under the supervision of a licensed practitioner in your discipline. And after that, you can sit for your licensure exam and then often become licensed at that point.
Yeah, and just to add some additional information about the school counselor. So I know that there are some like master's level programs for school psychologists. I think they're considered like specialist degrees. And school psychologists would typically do more of that assessment piece, so doing things like determining areas of eligibility for IEP plans and 504 plans. And then there's also master's level school counselor programs. And my understanding is that school counselors help provide more of like the mental health services and different types of planning like that in the school system.
And a good place to start, if you're interested in any of these sort of programs, a good place to start looking is at on the CACREP website, CACREP. That's the like accreditation board for a lot of master's level programs, including mental health counselors, school counselors, also like career counselors, different programs like that. I believe marriage and family therapists have a different one. I believe it's the American Association of Marriage and Family Therapists, but all of these websites will have accredited programs throughout the nation that would be a good idea to start looking at, just because you want your programs to be accredited under whatever board is in charge of that specific field of study.
Yeah, I agree with that. And I think that the information here on this master's degree slides, I think what we're trying to communicate here is that so often when Kelly and I are talking with undergraduates about their decision to go to graduate school, a lot of people say, like, I want to get my PhD in psychology because I want to do therapy. And there are so many really necessary fields out there, jobs that we need people to do, and that they serve such an important role in our society. And there's really good training programs in these areas too. And you can do therapy in these areas as well. So it's like if your goal is to do therapy, like there's other options besides a clinical PhD program. If clinical PhD programs are what you're set on, that's great. But for those of you who may not be wanting to make the 5 to 7 year commitment and are really interested in clinical work, there's a lot of different avenues that you can take. But for those people who do want to go and pursue a doctorate degree, there are PsyD or PhD programs. PhD programs tend to be a little bit more research-based, whereas PsyD programs have more of a clinical focus. And I think we have a slide coming up that differentiates those two degrees a bit more. But there's different areas of which we can get these degrees. So the first is clinical psychology. This focuses on the balance of research and teaching and clinical work, kind of being able to do all three, which is one of the reasons that I chose a clinical psychology PhD program, is because I like all three and I like the balance between them. And again, they're traditionally more research focused. There's also counseling psychology. This also has an emphasis on research and counseling, but it's more so with quote unquote normal populations, whereas clinical psychology works with more severe mental illness. You see a lot of counseling psychologists working in counseling centers at universities, things like that. Then there's school psychology, which we mentioned a little bit earlier, where you can do different assessment practices in the school system to help people get matched up with appropriate IEP plans and 504 plans. And these take about 4 to 5 years of academic work and then a year-long internship. And then some states, depending on where you want to live and where you want to practice, some states require that you do a postdoc experience of like 1 to 2 years after that before you become licensed. And then some people, just regardless of the state requirements, they choose to take that for additional training and maybe like a more specialized area.
And just one thing on that, in terms of like the postdoc, the 2-year postdoc, that can vary in terms of what you will do depending on your career goals. So for example, if you want to go into a more research-focused career where you want to work in academia, so as a professor in a university or in a research center, that postdoc could be research-based, whereas if you wanted to become a clinician and mainly do therapy, you would have a therapy-focused postdoc position.
Yeah, so those are great opportunities to kind of like narrow in your focus and get additional training in like a specialized area.
These are just some other doctoral level degrees that you can go into in the field of psychology. So industrial and organizational psychology, it's really looking at psychological processes and how they apply to the business world. So a lot of times you go in and you really serve as a consultant and you're kind of diagnosing an organization's ability to perform in just different ways that people are interacting with each other and how that impacts productivity and just different business related outcomes. human factors, it's more so about how psychology is applied to different products, technology, and the environment. They do some interesting work just in terms of like ergonomics, just kind of the way that like, just how humans interact with different products in their environments that they're in. And again, you really serve as like a consultant in a lot of these these firms that you would work for. An applied or an experimental psychology degree, it's basically, clinical psychologists without the clinical work. So mainly these individuals become researchers or professors. So for example, we our applied or experimental program here at Old Dominion University recently transitioned to, or is newly named as the health psychology program. So individuals who pursue PhDs in health psychology at ODU often go on to become researchers or professors at various universities, but don't get any of that clinical training. So if you're more research focused and that's all you want to do, you don't want to see clients in therapy, that could be a good avenue to look into. So all of these programs, again, they require about 4 to 6 years, which is typical for all of the doctoral programs that we've been discussing. And one thing about the IO human factors and like experimental psychology programs is I don't believe that for any of them you get licensed. So because you're not doing any clinical work, but you still get your PhD.
Yeah, and there are some programs like master's programs in like IO psychology and also experimental. So I know a few people who have master's degrees in experimental psychology and they work at community colleges and teach at that level. And I also know people who have master's degrees in IO psychology and they work in like human resources departments for larger companies and service consultants for them. So there are, I guess, again, it depends on your goals and whether or not the master's or the doctoral program works best for you. But in all of these areas, there are master's degrees for them as well. So now we're going to transition into like what can you do now if you are interested in applying to graduate school. And the first step would be to take the GRE. The GRE is one of those tricky tests that are not fun for anyone, but it's an unfortunate requirement that you just have to do to get into different programs. Different programs weigh them differently and use those scores differently. I would say not to get, because it is a difficult test, if your scores are not exactly where you would love for them to be, I would say don't be discouraged by that. Some programs use them as kind of like a weeding out tool, and that they may get hundreds of applications and they only have 5 or 6 spots. So maybe they use the GRE score to decide who they're going to bring in for interviews and just to try to reduce the applicant pool. But I would say that that's not the case for most places. Most places really try to look at your application as a whole and look at other components. And so if the GRE score is not stellar, then that's certainly okay if you have good experiences and have good letters of recommendation and other things that you can tie in. So the GRE is super important to study for and try to prepare for, but I hope that Kelly and I can share that it's just not the end of the world if you don't get the exact score that you're looking for. Kelly, do you have anything to add about the GRE?
Yeah, it's just really, I think the most important thing is just to understand the test and to practice as much as you can. So I'm not sure if the GRE has changed since I took it, but when I took it, you basically have 3 sections, like a writing section, a quantitative section, and then like a verbal section. And essentially the first subtest that you take in each of those 3 disciplines kind of puts you into like a tiered process. And if you're in like a higher tier, that automatically makes it easier for you to get a better score. But if you're in a lower tier, even if you do perfect, you won't score above a certain percentile. So just kind of getting to know those little nuances of the test, know that you need to do well early on in the test. And something that I found really helpful was just to really block time and give myself practice tests that took the full 4 hours or whatever it is, just so you can get like the pacing down, because that's definitely important to be able to maintain your stamina throughout the test.
Yeah, I agree. I started studying the summer before my senior year of college. And me and a friend bought the same study books, and the study book came with several practice tests. So we would agree like every week or week and a half to finish a test. And then we would get together and score each other's tests and then go through the ones that we missed and kind of talk about why we struggled in that area, or if like one person got the answer right but the other person didn't, explain their reasoning in that and helping each other learn in that process. I personally struggled in the quantitative section more so than the others, and but I didn't know that that would be an issue until I took the practice test. And once I realized that that was kind of my area of growth, I found some old like math textbooks and stats textbooks from like algebra books and stuff like that from my courses that I took earlier in college, and I was able to review using those. So I agree. I scheduled like 30 to 40 minutes a day to study, and I would alternate between the writing and then the quantitative and the verbal. And there's some really good free resources out there. I think that there's a website about GRE training materials, but there's like free apps where you could study with like flashcards, and then there's lots of free tests and things that you can access, or there's a website that has like a free different test question every day that you could log on and try. So there are lots of free resources out there, but I do recommend also buying or borrowing previous GRE study books from people and studying in groups. I think can really make a difference.
Definitely.
The other piece that you can start doing now is relevant research and clinical work. Research is a big thing, especially if you're trying to get into those PhD programs that tend to be more research focused. So you could ask your academic advisor or other faculty members in your department. Most psychology websites, department websites have like little brief descriptions of the faculty members' research. So if there's someone that really sticks out to you and has like overlapping similar interests, you could reach out to them to see if they have a spot available in their lab that you could become a research assistant. And even if they're not taking research assistants at the time, it's still good to reach out and make those connections, because they may be taking research assistants over the summer or next semester, and they can remember your name and know that you're interested in that.
One thing to just point out about research too, I think oftentimes a lot of undergrads get a lot of like in-lab experience, but not often some of the materials that we need out of that. So that would be like poster presentations or trying to get onto like manuscripts and that become published. So advocating for yourself if you are working in a lab, and just saying, I'm interested in applying to grad school. I know I need to get poster presentations and publications out. Are there any opportunities for me to pursue those sort of opportunities in your lab? Those are important questions to ask if you're seeking out new research experiences.
Yeah, I agree. And they could even be like, there's larger national conferences that you could present at, but there's also like a lot of local conferences that you could present at, or even like symposiums offered by your university. So any type of experience in presenting research could be really helpful in your applications. Another avenue is conducting your own independent research project. I did this as an undergraduate as part of my honors college program. So there's always opportunities through honors colleges usually to be able to do independent research. And even if it's not a part of the honors program, so maybe your faculty advisor or someone like that could get you set up in that area. One thing to note is that it's okay to take a gap year between your undergraduate and graduate careers, and a lot of times that's where people do get that extra experience, is that like you are also busy as undergraduates and you have a lot of other responsibilities, and maybe the idea to apply to clinical psych graduate programs or PhD programs didn't come along until later in your undergraduate career, which is totally okay. If you decide to take a year off, a lot of faculty members will have graduates in their lab still, and that's still opportunities to get research. Kelly and I right now, we have a person in our lab that graduated from ODU like 1 or 2 years ago, and she's getting ready to apply to graduate programs, and she wanted more research experience, and so she's volunteering in our lab now. So you don't feel like, oh my gosh, it's my senior year and now we have the coronavirus going on and research has stopped. there's always opportunities after graduation too if you ask, and it doesn't even have to be at your university that you graduate from. I've heard of people going back to their hometown and reaching out to faculty members at the local universities there and getting opportunities to volunteer in their lab.
Yeah, and I would just reiterate that that's actually a very common experience, especially if you do want a more research-focused career, is after you graduate, you'll oftentimes work more in a research center. Oftentimes, usually with somebody who has like federal funding for a research study, and you work as a research assistant in that sense, and that's a really great experience to get right out of your undergraduate degree.
I agree. I went to one doctoral interview, and I think there was like 8 of us there interviewing to work with one faculty member. And I would say a majority of those people that I would talk to that day, they were all coming from one of those like federal funded positions that Kelly was just speaking about, working on somebody's grant or something like that to get that research experience to prepare them for graduate school applications. Another piece is gaining clinical experience, and this is not necessarily gained by doing therapy per se, because you do have to have a license to do those things, but there's plenty of other things that you can do to work on developing the basic skills of working with other people. So volunteering on different crisis hotlines or at the UP Center that we have here locally. When I was an undergraduate, I volunteered at a domestic violence shelter. So just any types of things. I was recently working with an undergraduate. She was a peer advisor and helped people like sign up for different classes and make sure they were meeting graduation requirements and things like that. And when she was describing the things that she did to me, I was like, wow, it sounds like you're developing just like those basic soft skills. And so she was able to talk about that in her application as well. So any type of experience of where you're working with other people and you're building those basic foundational skills of like listening to other people and making others feel heard and helping them in some capacity, that can be classified as like relevant experience for graduate school applications.
All right, so now Cassidy and I are just gonna give you guys a little bit of an overview of our journeys from undergrad to our PhD programs and just some of the experiences that we had along the way. So I completed my undergraduate studies at the University of Connecticut, and I actually started out as an English major, which I really liked. But along the way, you take, kind of your general education credits, and I found that I really liked the psychology courses that I was taking. And the more that I kind of was thinking about what I liked about English, it was about like analyzing the characters in the books and the pieces of literature that I was reading. And because of that, I decided I wanted to pursue psychology degree as a second major and ended up going into a psychology route instead. And during my undergraduate career, I was involved in a number of different research labs. I did a number of studies looking at the influence of like partners, so romantic partners or spouses, on individuals' eating behaviors, which was really interesting. Those studies were funded by national grants, so those are really great experiences. You can get those as well. And I really liked that. It involved a number of different tasks that are important if you're developing a research focus. So like data management, learning basic data analysis skills, bringing clients into the lab and getting them, screened and undergoing various tasks. This particular study that I was working on also involved administering like therapy groups as well. So that was a nice experience to be involved in as well, and gave me a little bit of clinical work while I was doing that. I also did, I wasn't really sure what I wanted to do in terms of whether I would like clinical work, so if I would like doing therapy, just because when you're not licensed, like Cassidy was saying, it's really hard to get actual clinical experience. So I thought that for me, it was important to pursue a master's level degree rather than go right into just kind of a research program, or just like a paid research program, and just kind of working more in research at that time just to see what I liked. Because I knew that if I went on to get a master's degree, I would also have the opportunity to continue working on my program of research, just since I would still be affiliated with the university. So I then went down south, went to Florida State University, where I received both a master's and an education specialist degree in mental health counseling. And that was a 2-year program. The program itself was clinically focused, but I was very research focused. I've always loved research. That's been my favorite part of psychology and all the tasks that I do. So I was heavily involved in research throughout my time there. In terms of clinical work that I did, though, I was fortunate to be able to work for my practicum experiences and my internship there as a clinician at an eating disorder treatment center. I was at the partial hospitalization level of care, which means that clients basically get there early in the morning, about 8 a.m., and they stay all day long. So they really until like after dinner time, and just spend the day in individual therapy sessions with me or another clinician, or in groups with one of us as well. And it gives them good opportunities to gain support not only from clinicians, but also other individuals who are coping with eating disorders, which can be a big part of the recovery process. During my time at Florida State University, I also worked in our College Health Promotion Center and did a lot of eating disorder prevention work and substance use disorder prevention. So both of those involve clinical tasks. So for example, for the substance use disorder prevention, this would typically involve groups for students who are underage and caught with alcohol in their dorms or caught drinking out in the community, and would be mandated to undergo just a treatment group just to gain some coping skills to help them manage their drinking in a safe way. We also had an on-site training center where we served people in the community who for free for mental health services. So I basically just did therapy with really anybody who in the community who needed care. And that was I think it was just one night a week. So it was just on an outpatient basis, and I saw a number of different clients with different presenting problems there. As I mentioned, though, I've always loved research, so it was really great to gain a lot of those clinical experiences, but my interests were always in research. So I knew that after graduation, rather than pursuing licensure from my mental health counseling degree, I wanted to go into a PhD program so that I could eventually become a professor and work in academia and continue to build my program of research. And I ended up here at the Virginia Consortium Program in Clinical Psychology. And I'm doing our program's either a 4+1 or a 5+1, which means you do either 4 or 5 years in residence, and then your 1-year internship degree, or internship year. And I'll be here for an extra year. I actually got federal funding for, and it's called an F-31 grant that helps to fund my dissertation study. So I'll be able to stay here for an extra year to finish up conducting that. And some of the clinical work that I've done here, I've worked at the Hampton Roads VA in the Outpatient Behavioral Health Center. I saw individuals with a number of mainly behavioral health concerns, so struggles with eating, not just eating disorders, but just difficulties eating in general, substance use, and also just very affective disorders as well. So various anxiety or depression-based disorders, and of course PTSD, which is very common among veterans. I've also had a number of different assessment placements here as well. So I worked in an outpatient center during my first year. It's called Neuropsychological Services of Tidewater. And I'm currently placed at EVMS in our neuropsychology department, and mainly do neuropsychological assessments there. And after Cassidy presents, I do practice from a CBT perspective, which we can go into a little bit further about what that looks like.
So like Kelly, I also got my master's degree before coming to the Virginia Consortium program. So I graduated from UNC Pembroke in 2016. I knew that I wanted to be a psychology major from like day one. But then I was at the time I was really struggling with whether or not I wanted to go to law school or if I wanted to pursue a clinical psychology PhD. So I declared a minor in legal studies because I thought the classes were super interesting and I really enjoyed them. And I was leaning more towards the psychology side of things, but I wanted to make sure, and I knew that those classes would help me make that decision. And so while I really enjoyed those classes, my heart lied in the psychology side. So I ended up I'm doing some research. After I took my research methods course, I really enjoyed it, and I volunteered in a lab and helped conduct several studies there at UNCP. We focused a lot on body image, and also about the sexualization of women in the media. So I completed a few studies through that lab, and then I also completed an undergraduate honors thesis looking at body esteem and how social media can impact that. And then when I graduated from UNCP, I applied to both clinical psychology PhD programs and master's level programs in psychology. I was accepted into both types of programs out of undergrad, but the PhD programs that I had, like the options I had, they were not good fits for me. And I think that deciding on a graduate program, it's such a large time commitment. It's really, really important to make sure that the program is a good fit. And the program was not a good fit for me for a variety of reasons. So the master's level program that I was accepted to at Appalachian State University was a perfect fit for me. And the mentor that I was accepted to work with there, our research interests were like a perfect match. Whereas the other programs I was accepted to, it was more of a stretch to kind of make my research interests match with them. And so I knew I would be doing like exactly what I wanted to do while at App State. In North Carolina, you can become become licensed as a master's level psychologist. So my program prepared you for that type of licensure. So we did 2 years of academic work and then a year-long clinical internship where I was basically working full-time in a community clinic providing both therapy and assessment services. So my master's program was 3 years, which tends to be a bit longer than some master's programs. But again, it was because it was preparing you for that licensure. There were 8 people in my cohort at App State, and 3 of us went on to clinical PhD programs. One person went on to a counseling psychology PsyD program, and then the other 4 became licensed and are working in the prison system in North Carolina. They're working in the private practice, and the other is working in like an integrated care setting. So while I was at Appalachian State, my program was more so clinically focused and research focused. I had experiences at a community clinic where I worked with both kids and adults doing mostly assessment there. And then I also worked at a college counseling center. And at that college counseling center, I was involved on the eating concerns treatment team. And this was a multidisciplinary team where we had medical providers, nutritionists, and psychologists working together to help the students that were enrolled at this university who had diagnoses of eating disorders. And so we worked together to make sure they were getting the care that they needed. It was a good opportunity for therapists to meet with medical doctors to see how things were coming from a medical perspective, and for the medical doctors to know how things are coming from the therapeutic standpoint. I also was involved in individual therapy and group therapy while working at the counseling center. Like Kelly, I also operate from a CBT perspective. And so while I was doing therapy, I treated several specific phobias. I treated a lot of anxiety, a lot of depression, and a lot of PTSD, actually. So I used a CBT framework for each of those. And so, for example, like when I was working with clients with clinical depression, we worked on some activity scheduling and pleasurable event scheduling so that to tackle that behavior aspect of the CBT triad. And Kelly and I have some resources later in the PowerPoint about just like what those types of techniques and interventions look like that we used. We may not have time to go in a lot of detail about them, but they are there for you to look at. And we'll probably just like briefly go through them a little bit here in a couple seconds. But yeah, I did a good bit of therapy and assessment. I did most of assessment with children. So we did a lot of ADHD assessments. We did a lot of assessments for the school systems to see if kids qualify as having a specific learning disorder. And then I also did some assessments with adults who had just really been struggling in previous therapy, not getting the outcomes that they wanted to and not having successful experiences. And so they would come to our clinic to get a diagnostic assessment to really narrow in on what their presenting concerns were and to try to find the most accurate diagnostic label for them to help inform future treatment. So those were a summary of the clinical experiences that I had in my master's program. And then here at the Virginia Consortium, I am currently in an assessment practicum placement with the Virginia Beach City Public Schools. Due to the current circumstances with the coronavirus, the Virginia Beach public school system is closed for the remainder of the school year. So I'm no longer on site working for practicum. So I'm doing things from home as much as I can, but you can't get new assessment data when the kids aren't at school and you don't have the opportunity to work with them. So a lot of my personal clinical work right now has kind of come to a stop because of the coronavirus and the closures that are associated with that. But once this picks back up, once the schools reopen, I will be doing some more work within the school system. I don't know if you can tell from my experiences here, but I tend to be more assessment focused than therapy focused. I love assessment. I think that it's a nice opportunity to gather all these pieces of information from different people and like different sources and be able to put those together and kind of create this big puzzle. And I think it's a fun experience, and it's challenging to be able to put all those pieces of the puzzle together. And it also is really rewarding because when you finish that assessment, you're giving the client a very thorough and detailed report about their presenting concerns and all the information that you found, and you're able to answer specific questions that they may have had coming into that assessment process. And then at the end of every report is usually a list of recommendations. And so the client is not only leaving with like answers to their questions, but they're also leaving with specific recommendations that they can use to implement, and ideas for therapy and things like that that could really help them. So I really enjoy the assessment process.
I agree with that as well. I know I mentioned earlier that like I am mainly research focused, but I find that assessment mirrors research in a lot of ways for the reasons that Cassidy just mentioned. In terms of, you're often starting off with like a research question or like a clinical question in terms of, a client comes in, is experiencing, memory related concerns, having difficulties concentrating, and they're looking for specific treatment recommendations or specific diagnosis that can help explain their presenting symptom. And then you go through a systematic process of testing clients to see areas that they are doing well in and the areas that they are having some difficulties with. And you end up coming up with the product, so-called product of the diagnosis and the treatment recommendations. So I would agree with that as well.
Yeah, I know that you all have covered assessment in your clinical psychology course, and maybe Kelly, it would be helpful if we talked a little bit about like the assessments that we most commonly use.
Sure.
Kelly's a third year in the program, so she's had more practicum experiences. So maybe you can talk, and our practicum experiences right now, even though they're both assessment focused, they look very different from each other. So maybe you could talk just a little bit about like what your typical like battery looks like.
Sure. So I see individuals all across the age spectrum, so probably from 5 years old to 85 years old. And usually there's kind of like a standard battery for children versus older adults or individuals with memory-related concerns. So with everybody, we usually start out with some sort of intellectual assessment, and that the specific test will vary based on their age. So it'll usually be a WISC if they're a child, or a WACE, which is they're both Wechsler assessments, but just differentiated by age. But sometimes we choose different assessments as well, such as the Sanford-Binet. If, for example, if it's a child, for example, and they've been attested multiple times in the school system with WISC, then there are concerns about practice effects, or that, they kind of understand the test, they get what's going on, what you're going to ask them, and it's not really a true assessment of their intellectual functioning at that point. For kids, we also usually do a measure of academic achievement, which is helpful in diagnosing specific learning disabilities if that's something they cope with or they're struggling with. Different like aphasia tests as well if they're having like language difficulties. We'll do a lot of executive functioning tests for both children and adults. So that's just basically just like brain processes. So how your brain works in terms of like problem solving skills, your ability to, like your semantic fluency, your phonemic fluency. So For example, if I gave you like the first letter of a word, could you tell me like a bunch of other, if I gave you a letter, could you tell me a bunch of words quickly that start with that letter, things like that. Yeah, so we do a lot of those tests. For adults, they're usually coming in with memory-related concerns, and that could either be due to age or, like, for example, I get a lot of athletes, specifically football players who have struggled with concussions, or people who have had serious accidents and have brain-related injuries. So we'll do a lot of memory tests with that as well. And yeah, so that's usually what we do. We also do like motor functioning, so fine motor skills, visual motor integration, and then a lot of self-report measures, which is especially important for kids, especially if you're diagnosing ADHD or trying to rule out ADHD, seeing which symptoms are present in different environments. Also for like autism screens as well, that's really important to get those like behavioral observations from a parent or a caregiver. Usually for older adults, observer report measures will be based on their ability to complete like activities of daily living. So can the individual just kind of go about their daily routine in terms of grooming themselves, cooking for themselves, doing like household chores, or are there times when, for example, they start putting something on the stove and then forget about it, and then the fire department gets called, like things like that. Do they forget where their keys are? Yeah.
Yeah. So in the school system, we are primarily doing testing to see if kids meet eligibility criteria for different categories to receive special education services. And without going into too much detail about that, because that could be like an entire lecture in and of itself, talking about how that process looks. But basically, the IDEA Act said that like kids can get special education services if they meet certain criteria for certain categories. So there's categories of autism, there's categories of emotional disturbance, there's categories for learning disability, for developmental delay, for other health impaired, which can relates to a variety of medical diagnoses, including ADHD. And the whole idea of this is, do they meet criteria for different concerns, and do those concerns negatively impact their performance in school and their ability to do well in school? And so we get referrals from teachers and parents and within the school system, and a lot of times these referral questions relate to the kid falling behind in reading or falling behind in math and not meeting grade level expectations, or they are just like really withdrawn at school and they're not doing well, or they have a lot of impulsive and hyperactive behaviors. And so we meet as a team, and on this team there's principals, there's psychologists, there's social workers, there's teachers, there's special education teachers and regular education teachers, and the parents. And we all meet together and come up with like, what are the main concerns? And then depending on what those concerns are, we do different testing. So if there's a concern about whether or not the child has autism, we refer them to a autism diagnostic team, and they will complete the ADOS. If the concern, so I'm not as involved in that much of the process, but most of the time I see concerns related to referral questions of learning disorders or ADHD. So if that's the concern, then we start off by doing the WISC, because we're seeing children. Right now I'm working in a high school and an elementary school, so sometimes depending on if my high schoolers are like seniors, I've had to do the WACE. So we start off with some type of measure of cognitive ability to get an overall idea of what their current IQ is and where they fall in terms of cognitive abilities. Then we also do a measure of educational achievement. So most commonly I use the Woodcock-Johnson test of achievement, or also the Kaufman test of educational achievement. And those measure skills in reading, writing, and math. And then I also will do a classroom observation, where I go to the classroom and observe the kid for about 20 to 30 minutes. Sometimes I go several times, and usually when I go more than once, I try to split up like the time of day that I'm going or the class that they're in. So in high school, if I observe a kid in math, I'm also going to go observe the same kid in maybe like a science class or an English class. And usually I try to pick an area in which they're doing well in academically, and then I try to pick an area in which they're struggling in to try to see if I notice any differences or anything about the classroom environment that may be contributing to those differences. In addition to the observation, we talk to the parents, we talk to the teachers, and we ask them to fill out a number of informant reports. So if the main concern is ADHD, we're going to ask them to fill out reports specifically looking at attention and hyperactivity concerns. If the concerns are not ADHD related, maybe it's more like, I don't know, I think this kid just really has, maybe he has a learning disability in math, or she's really struggling in English. I'll give a BASC, which is more of a global functioning assessment. And depending on the child's age, I may also have them fill out those reports. Usually if the child is in like kindergarten or first grade, the assessments aren't normed for that age range. And so I don't give self-reports for them, but I will talk to the parents and talk to the teachers and ask them to do informant reports. A big thing that we operate on in the school system is we look for 3 points of evidence. So if they're for ADHD, for example, if there is a concern about inattention and hyperactivity, I look for 3 sources of evidence supporting that diagnosis if that's the route that I'm going to take. So maybe I'm seeing it in the classroom, I'm seeing those symptoms of inattention and hyperactivity. So that could be source 1. Source 2 could be the teacher reported it on their reports. So that would be the second. The third source could be the parent also reported it. That way it's like I'm getting 3 sources of information, and I saw that in 2 different settings. There's like the parent is seeing it at home, and the teacher and I am also seeing it at the school. So that's kind of a good general rule of thumb to use when you're doing any type of assessment in a variety of settings. But other assessments that we'll use in the school system, depending on the presenting concern, like if there is a concern of like emotional disturbance or another mental health concern, we will do like personality measures. We can also do more just like diagnostic interviews if it's relevant. Because it's in the school system, we tend to try to keep our batteries short because we don't want to pull the kids out of class too much for testing. So that's another thing that may be a little bit different about our sites right now too, Kelly, is my understanding is that you do a lot of your testing like in one day, correct?
That's correct. Sometimes we'll have to break it up for a kid, but rarely will we do that. So my batteries can last from about like 4 to 8 hours. And, sometimes with the kiddos, we do say, okay, we'll let you go out with your mom for, 20 minutes and take a quick breather and then come back in and finish up. But we usually do try to get it all done within one day.
Yeah, and at the school system that can be harder because like they can't miss lunch and you don't want to keep them out of class too long. So, and just because of their attention spans, and these tests can be really exhausting, especially if you're giving a kid who really struggles in math, a math test. They're probably going to be discouraged and frustrated, and it's not a good idea to continue because you're just not sure if you're really getting the most valid results. So a lot of times I'll see one kid like 2 or 3 times for about an hour to 2 hours each time. All right, so next we have just a little bit about the CBT model. Kelly, do you want to talk about this a little bit?
Yeah, and we'll go through this pretty quickly because I know we're running out on time here. But essentially, this is just the main conceptual model that I use when I'm presenting CBT to my clients. And it's basically a good way to just show that the way that we think impacts the way that we feel and the way that we behave. And when I'm explaining this, I always put my hands in a triangle and I say, our thoughts impact our feelings, which impacts our behaviors. I'm explaining this to clients and really break down just kind of that interconnectivity. And we talk about how in CBT, out of these 3 things, so your thoughts, your feelings, and behaviors, your feelings are really the only thing that you can't change directly, but you can change your thoughts and the way that you behave, which also impacts the way that you feel. So if you're generally feeling depressed, we're kind of looking for different thoughts and behaviors that maintain those feelings that you believe to be adverse.
Yeah, and that's essentially how I explain it to clients as well, really emphasizing the bidirectional relationship between these components. And in my experience, clients really they like this model and it makes sense, and usually they're like excited about the therapeutic work that we'll do, because it's like we're showing like we can target this one thing, for example, behaviors, and by targeting behaviors, we can influence your thoughts and feelings. And I think that that instills a lot of hope for clients. This is a thought record. So Kelly and I both use this a lot when we're working with our clients to kind of target the thought aspect of that triangle. So I use this a lot with clients that have anxious thoughts. So for example, I was working with a kid one time who was really afraid of the dark. So in addition to doing exposure therapy to different dark situations and sitting in dark rooms alone, eventually working him up to being able to sleep by himself alone, we also did some modified thought records to be more kid friendly. I would say this is something you would more likely use with an adult. But use some thought records to kind of go through those automatic thoughts and kind of testing the validity of those thoughts, like what's some evidence here that supports this thought, what's some evidence that don't, and considering those different challenges that you come up with, what's a new way to think about that.
I would agree. I find that thought records in particular are really helpful, because oftentimes we'll have a client who will come in and say, yesterday I went to work and just things weren't great, and then I came home and then I spent the night binge eating. Well, okay, so that happened, but there's a lot of things that happened in between that. So in between going to work and when you started binging. So using a thought record really helps you break down all of those links in the chain. So what were you thinking? What were you feeling? What were you doing? What were you not doing? What were your interactions like with others? All these things, they collectively influence what the outcome of the binge. So just kind of breaking it down provides opportunities to intervene a little earlier in the cycle the next time. So for example, if a client is having, negative thoughts about, maybe they're just stressed at work, maybe they're having difficulty getting along with their boss, and that's making them feel really down on themselves, feeling like they're unworthy, then we'll start working on those addressing or challenging those thoughts that they're having to help break that chain that kind of set off that track down to the binge later in the night. So I think that's really helpful.
Yeah, and I think that the thought records are an intervention in and of themselves, but I love when we collect a lot of thought records throughout therapy. So I will have, like Kelly said, bring them out during session and walk through past situations with clients, but I will also send them home for practice. And if clients are, I ask them, like, if they find themselves feeling really anxious in a particular situation, to sit down in the moment and fill out some of those thought records. And then I make copies of those to keep for myself in their records, and then the clients also keep copies. But then after we've collected several of those records, I like to lay them out on a table with clients and look for overall themes that we see happening. And a lot of these times we see these unhelpful thinking styles emerge. So there's several thinking styles. These are just examples of 3 of them, but one of them could be jumping to conclusions. And so it's like when you have 5 or 6 thought records laid out and you're like, in most of these examples, my anxiety was related to the fact that, like, I was mind reading or I was trying to tell the future, and I don't have a crystal ball, so I can't tell the future. And I'm just really looking for those overarching thinking styles that are maladaptive and aren't helpful. And once we kind of have an idea of what unhelpful thinking styles are most prevalent, we can go about trying to intervene in a more effective manner.
Yeah, and we won't go too far into core beliefs, but this is so basically with CBT, you're at the level of like automatic thoughts, so thoughts that happen just kind of throughout your daily life, and then sometimes you work down a little more towards certain like intermediary thoughts. So those are like if-then statements. So if I go out, push myself and go out and do something that makes me feel uncomfortable, then everything's going to be terrible. I'll get made fun of, etc. But if we keep breaking that down, usually in the course of like a longer term treatment than you would see in just kind of like a general outpatient center, we often find that individuals have a lot of these core beliefs or these deeply enrooted thoughts about just kind of their general sense of worth. So I'm not worthy, I'm not lovable, I'm helpless, I'm hopeless. And these thoughts feed back into the way that they kind of think about themselves and situations in their world just as they go about their daily life, and they impact, like we were saying before, the thoughts and the feelings and the behaviors that they have. So this is kind of the core of CBT that you get to, especially if people have been coping with a mental illness, mental health concern for a long time. It's often rooted in some sort of core belief that we'll want to start challenging and addressing.
Yeah, I think, like Kelly said, it can take a while in therapy to get to these core beliefs, but once those core beliefs are uncovered, there's a lot of opportunity to do really powerful and effective work in challenging those core beliefs and coming up with new alternative thoughts that can be helpful. This is the kind of the scheduling piece that I briefly mentioned earlier that I will use a lot when I'm working with clients with clinical depression. And even anxiety. I've used this before when I'm just trying to get people to schedule some self-care in there, but these can be used for one, I usually have clients track how they're spending their time, and I ask them to rate the extent that they enjoy that time, and then rate the extent to which they feel good about their ability to do those things. And then after we kind of track it, we decide, we'll look for things like, oh, I don't spend a lot of time doing things that I enjoy. And so we'll try to the next week start with like a blank one of these and try to specifically schedule something that they enjoy. And this helps get at the behavior piece of that triangle, because even it could be simple things like taking a shower or going out into the sun. Those things are like inherently beneficial, and then they can cause more positive emotions. So sometimes it's simple things like that, and then sometimes it's more like dedicated time to sit down and read a book that you enjoy, or dedicated time to schedule a phone call with a friend or something like that.
And it's amazing. Oftentimes I'll have clients who are like, well, what's it going to do if I just take a 10-minute walk, or I read a book for a few minutes? It's not going to do anything. Like, I still have all these stressors and whatnot. So that comes back to kind of just challenging a lot of those thoughts and saying, well, let's try it out. Let's see what happens. Let's treat this like an experiment. What if you tried this? What's the worst that could happen? But it really does make a big difference to just kind of engage in those self-care activities, even if they're brief and only, once a day.
And then here's another component of activity planning to maybe if like the hour by hour structure doesn't work. Some clients may prefer just kind of talking more generally, like morning, afternoon, and evening. So there's like two different approaches, and it really depends on the client and their needs of like which approach may be better. I have found the most success in my work with the hour by hour schedule, but that could vary based on the client.
And just as a note, the hour by hour for like OCD, that can be challenging too, just because sometimes it feeds into a lot of those like perfectionistic obsessive compulsive behaviors. So sometimes taking that broader approach would be more helpful.
Yeah, that's a really good point. Taking the broader approach could help like build in flexibility and things.
And yeah, so I think this is our last slide here. Just kind of gives you an overview of certain mental health concerns that CBT has been proven to be effective in treating.
Yeah, and you can always go to Division 12's website. They have a lot of information. I've used this website actually when I'm building the recommendations for my reports, and just pulling research and sources from there. Like when I find a diagnostic label that I think best describes a person's presenting concerns, and then I'll go to this website to pull information about what treatments seem to be effective for it. So there's lots of information here that could be interesting to take a look at. But if you all have any questions for us, feel free to reach out to us by email. Both of our emails are listed here. We're happy to chat with you about grad school in general, our experiences in any of our programs. Maybe you're interested in applying to a program that we have been a part of at some point. Like I personally am happy to talk to you about that, and I know that Kelly would be as well.
Definitely. Yep.
Yeah. And during these next few weeks where we're like working from home and stuff, if the conversation that you want to have even would warrant more than just an email. I'm happy to chat over the phone or do a Zoom call or something like that if anyone has any additional questions.
Yeah, and I am as well.
All right, well, thank you so much.